Hello, everybody. Welcome to another video lecture. Today, we're going to be talking about health inequalities. Okay, so if you remember in the previous lesson, we talked about inequality as the unequal distribution of social rewards. And so often when we think about social rewards, we simply think about money. We think of inequality as the fact that some people have more money and some people have less money. But as I mentioned, it's important to realize that social rewards are not just money, but there are other things that humans value. And so one of the things that humans value is health, right? How healthy they are. And so what we're going to see in today's lesson is that it's not just that our society experiences inequalities of money, but we also experience inequalities of health. And we're going to see that these two things are actually connected, that people with less money have worse health, and that people with more money have better health. And so this is really, the unequal distribution of health. So let's jump right in. So kind of to review what the lesson is going to be about today. So first, I'm going to review the reading for today. Normally, I like to have a good discussion of it because I really like this reading, but unfortunately, I'll just have to review it. Then I'll talk some basic facts about the relationship between health and economic inequality. And then we'll have some kind of concepts to understand this relationship, to see what's going on here. And then lastly, we'll talk about the causes, right? Why is there this relationship? Okay, so let's first talk about the reading. So let me kind of set up the basic idea of the reading. So Timmermans does a study of how people are treated when they need a life-saving medical treatment, right? So it is by the law, actually in America, everybody has to be given life-saving treatment. So like if you experience a cardiac arrest or some other event, medical personnel by law have to try to save your life. That's a pretty good thing, right? And so what we might think is because it's mandated by the law, then everybody is treated equally, right? It's not as if we're going to just save some people and not save others. And so therefore, there's a degree of equality, right? But what Timmermans finds is there is actually inequality. It's an inequality in terms of how hard the medical personnel will try. So unlike what you see on television, unfortunately, life-saving treatments rarely work, right? So on television, somebody, is drowning or something like that, and then they get CPR and they're suddenly, they're all better again. But that's actually not what really happens, right? In reality, only about 6% of people will survive, right? So the vast majority of people, end up dying. If you need life-saving treatment, if you need to get CPR or something like that, you're in pretty bad shape. And so for medical personnel, this means that, most of the time they know that they're going to be doing this and it's not going to do anything. They know that most of the time the person's going to die. They know, but it's mandated that they have to make an attempt. And so a lot of times what can happen is they can kind of go through the motions, right? That they can say, oh, well, it's probably not going to do anything, but I'm legally mandated to do this. And so, I'm going to go through the motions. I'm going to do the best I can. But, it's probably not going to work. And so what Timmermans wants to find out is, well, what makes people kind of step out of that routine? What makes people really try to save a person's life? What really makes people, medical personnel, EMT, doctors, nurses, what makes them really jump in and try to be like, oh, well, we really got to save this person. And so what he found is that there were certain social characteristics, right? It wasn't just, how healthy or sick the person was, or, their chance of survival, that there were certain social characteristics that were going on. So I can talk about some of the main ones. So one of the main ones was age, right? So the younger the patient was, particularly very young patients, that's when medical personnel really try to save a person's life. So if you were a child, if you're 6 or 7 or 9 or 10, then the medical personnel kind of jumped out of their routine and really made a full-blown effort to really rescue this person. On the other end of the age spectrum, right, if you were in your 60s or 70s and 80s, some of the medical personnel were like, well, maybe it's your time. Maybe you've led a good life, and maybe we shouldn't try to save this person. Right? And so we can see age as a social characteristic really kind of affected people's status. What we saw was kind of some of the moral notions of medical personnel. So if you were thought to have caused your own problem, right? Particularly if you were alcoholic or was a drug overdose, then the medical personnel, or in some sense, were less likely to give a full-blown attempt, right? They in some sense said, well, this person it's gonna just happen again. Really they're the cause of their own circumstances. And so they were less likely to, make a full attempt, right? And then other things, just like simply social status. So Timmermans shows how, people who are wealthier are more likely to survive. White males are more likely to survive than people of color, right? And so the social status of the person increased their chance of survival. And so he really kind of summed this up in terms of this idea of social viability, right? That if a person is viewed, right, as more important or more viable for society, then the medical personnel were more likely to view them as, giving a wholehearted attempt to save their life. And so we kind of see this in the title of the article, right? Social death as a self-fulfilling prophecy. And so the idea here is that if medical personnel viewed somebody as less socially viable, right, less worthy of a society's efforts, then in some sense they were socially dead, right? They weren't considered to be as important. And so that view, that idea of the worth of a person translated into not just their social death, but into their biological death, right? That if a person was viewed as less worthy, then the medical personnel gave less of an effort, and then were more likely to end up actually dead. And so, it's kind of an interesting, piece here, and the reason why I obviously shows it shows how your social status can affect your health, right? And it's a very vivid example of this, that your social status can affect, how you're treated in a life-saving emergency situation. Okay, let's now move on to the main kind of topic for today, right? And so the idea here is to see the relationship between somebody's health and their economic position in society. And so we can see that, when we're talking about inequality, it's not just about how much money you have. It's not just about the kind of car you drive, but it's really about your condition of your health and how long you're going to live. So we can look at this relationship in two ways. The first way we're going to look at it is the relationship between life expectancy and economic position. And then the second way is we're going to look at the relationship between economic position and health conditions. So let's start with the first way, right? Let's start looking at the relationship between life expectancy and economic position, how long you're expected to live and how much money you have. So here we see a basic graph, right? And so this is 1990s dollars, right? But the relationships is still holds true for today. And so what we see here in this graph is that basically, essentially, people with more money will live longer lives, right? And, there's a fair degree of effect here, right? That somebody who earns over $80,000 a year can expect to live 6 more years of life than somebody who earns less than $20,000 a year. So it's not just that the person has more money, but they get to have more life to spend that money, right? It's not, inequality isn't just about how much cash you have, but it's just how long you get to live on Earth, right? And sometimes, that's more valuable in some sense than money, right? But so what we see here is this clear gradation, right? The more money you earn, the longer you can expect to live, right? So we see this by income. We also see it by education. So education is kind of another measure of your social class. The more educated you are, the higher you're likely to get paid, the higher your income, right? People with with more education, have better jobs. And so this is life expectancy at age 25, right? So what we're going to do here is we're going to add about 25 years on top of all of these measures, right? And so what we see here is actually that education is even a stronger effect than just income, right? And so what we see here is that, let's look this in terms of women. We see that a woman with a college degree compared to a woman with a who drops out of high school, she will live about 12 years longer. And that's a fair amount of, that's a substantial amount of life expectancy, right? A whole decade more. The same is true for men, right? A man who has a college, is a graduate of college, can expect to live about 13 years longer than a man who drops out of high school, right? And so dropping out of high school will not just earn you less money, it will also dramatically shorten your life. And so again, we see the same relationship between how long you can expect to live and your economic position, your class position in American society. Right? Here we see the same thing again. This is the risk of premature death. And so premature death is the risk of dying before age 65. It's basically the risk of dying young, right? The risk of dying before you get old. This graph is a little bit harder to understand, but everything is measured against the wealthy people, 100,000 K and more. And so what we see is that people who earn less than $10,000 have 3 times the risk of dying before age 65 than somebody who earns 100,000. And then, the more money you have, the better your chances that you're going to make it to old age. Okay? But again, we see the same thing again and again, right? That there is this relationship between your economic position and your life expectancy. Here's an important thing. We should notice that it's not just a relationship that holds between the most wealthy and the poorest, but there is what's called a gradient of health effects. So what I mean by gradient of health effects is that a little bit more money gets you a little bit more life, right? That we're not just talking about the very wealthy or the very poor, we're talking about everybody, right? So everybody, the more money you earn 10,000, 15, 20,000 more than somebody else, you're not just earning more money, you're earning a little bit more life. You're getting a little bit more longer life expectancy. And so that's a gradient, right? That there's, always a step up. However, what we also notice with that gradient effect, right, is that there's also what's called a ceiling effect, meaning that at the top end, at the very wealthy end, the effect of getting more money or being of a higher social class position doesn't really get you much more, right? So for example, we see here, what's the difference between having a college degree and a graduate degree? Not much, right? Your life expectancy is going to be about the same. So for women, your life expectancy is still 62. For men, you earn, about 3 years longer, right? And so it kind of levels off at the end of at the upper end of the spectrum, right? It's basically the idea here is at some point, having more money, having $10 million compared to $1 million, is not really going to make you live that much longer, right? You know, there's only so long that the human body can be kept alive. And so being very extremely wealthy is not going to really make you live, you know, 300-400 years, right? And so there is a ceiling effect, right? That it kind of levels off at the upper end of the spectrum. Okay, so we've talked about life expectancy. And so life expectancy is a measure of, you know, your health, right? And so what we basically essentially see is that people who live longer have more money, right? They're higher up on that economic stratification system, right? They don't just have more money, they have a longer life expectancy. What we can see is, okay, what's one of the reasons for this is because they are healthier, right? But there's also a relationship between somebody's health outcomes and their economic position, right? So how can we see this, right? So we can see this in a few different ways. So first way we can see it is in terms of somebody's self-reported health, right? Do they think of themselves, would they rate their own health as being, you know, very good or excellent? And what we see here, again, it's the same story again and again. What we see here is that the more money somebody has, the more likely they are to say that they are in very good health, right? Or excellent health. Right? And again, there's that gradation effect. A bit more money means that you're a bit more likely to say that you're in really good health, right? Are the people correct in their self-assessment? So we can ask them what they think about their health. You know, is their self-assessment accurate? Yes, it is, right? And so what we see is we can look at a person's actual risk of various diseases. So for example, diabetes, you know, a very common illness in America, right? And so what we see here is that people with more money have much less of a risk of having diabetes, right? And so we see it's actually a pretty stark relationship that somebody who earns over $80,000 a year has about half the risk of having diabetes compared to somebody who earns less than $20,000 a year, right? So somebody who is poor, they don't just have less money, they have a much higher chance of having a health problem like diabetes, right? But again, there's this gradation effect. A bit more money means a bit less risk of being diabetic, right? Not just true for diabetes, but also true for heart disease, right? Again, more money means less of a chance of having a heart disease. Here, the curve is much more flat because, you know, heart disease is so prevalent. You know, it's one of the most common health problems Americans have. But, you know, again, we still see that same relationship. More money means less of a chance of a health disease. We see it for stroke, right? More money means less of a chance of having a stroke. And again, the relationship is pretty stark. You know, a stroke is a very serious health effect, a very serious health problem. And so we see that somebody who has over $80,000 has half the risk of having a stroke than somebody who has less than $20,000, right? And so really, you know, that's quite a dramatic relationship. And so what we see in all these things is that your economic position does not just determine how much money you have, but it determines your life expectancy and whether or not you will have a disease or illness. Now the question is, well, what about this what about cause and effect, right? Just going back to the first week of class, you know, we know there's this correlation between economic position and health. Does that mean that health, economic position is causing health? Right? So that's a tricky question. And so what we can say is actually it's a bit of both. That what we can say is that there's a vicious cycle between health and poverty that operates over a person's life cycle. Right? So the best way to understand this is looking at this graph here. Okay, so let's say that somebody is born into poverty, right? They are born into an economic situation in which their parents are poor, you know, they don't have much money. So that child is not going to get the same healthcare, right? They're not going to have as many postnatal visits. They're not going to have as many health checkups. They're going to have less visits to the dentist. They are not going to have as good as medical care as a child who has, is in a good, wealthy family. Okay, so they grow up like that, and so they end up having poor health. And so what happens is they have poor health. So what does that do to their school attendance? You can think about this. It means that they're going to miss more days of school. They're going to be sicker. They're going to be less healthy. And so that means that they're going to miss more days of school. And we know this, right? Children who are less healthy miss more days of school. Children who have less money miss more days of school. They miss more days of school because they're more sick, right? And so, okay, they're missing more days of school. They're not learning as well, right? They can't focus as well. And so their educational attainment is not as high. Right? They don't get as good grades in high school. What does this mean? It means that they're less likely to go to college, right? So if they're less likely to go to college, what does this mean for their income, their economic advancement? It means that they won't advance as high, right? That they're less likely to get a good paying job. They're more likely to stuck in a poor paying job, right? So they have, now their occupation and income, they have a poor paying job. What does this mean? Oh, they're less likely to get health benefits. They're less likely to have health insurance. And so they're less likely to have health insurance. So they're less likely to go to the doctor if they have a problem. And so their health is poorer. And so what we see is over the life cycle, there's this kind of terrible relationship between a person's economic position and their health outcomes, right? Their economic position causes worse health, and their worse health causes them to be unable to improve their economic position. And this kind of goes back and forth, over the course of somebody's life, right? What about what's happening over time? Unfortunately, the health disparities are getting worse, right? So what that means is that the gap in things like life expectancy, the gap in terms of people's health outcomes is getting greater, right? That there is a bigger gap between the wealthy and the poor in terms of how long they will live and what their health positions are like, right? And so that health disparities, that health inequality is getting worse, getting greater, right? So we can think about why, why would the health outcomes be getting worse, right? What do we know about inequality from the last video lesson that would suggest why these health outcomes are getting worse, right? We know that inequality is getting worse, right? And so as economic inequality is becoming greater, right, is becoming more unequal, then that is producing more unequal health outcomes, right? And so as inequality is going up in America, it's not just producing more economic inequality, it's producing worse health outcomes. Okay, so now we kind of basically got some of the concepts, some of the basic facts in this relationship between health and economic inequality. Now we want to have some concepts to understand this relationship. What are some kind of concepts that help us, appreciate and understand what's going on here? So I'm going to give you three. And the important thing to understand is these three concepts kind of go together, right? They kind of build off of each other. All right, so the first concept is what's called cumulative inequality. Right? And essentially the idea here is that in terms of health, the inequality accumulates over time, right? We can think of this in terms of health advantages and health disadvantages. Health advantages are things that keep you healthy, and health disadvantages are things that make you sick, right? And that what happens is that over time, a person will accumulate different amounts of these advantages and disadvantages. People with less money accumulate more disadvantages, and people with more money accumulate more advantages. right? And so that health is not something that inequality, your economic position is not something that causes you bad health all at once, but rather is something that slowly causes you to have health problems over time. I think a good metaphor, a good example here is smoking, right? And so, it's not as if, so smoking is bad for you, right? Smoking tobacco. So it's not as if smoking one cigarette will kill you like automatically. It's not as if you're going to have one cigarette and you're going to drop dead, right? But if you smoke half a pack a day for the next 30 to 40 years, yes, your chance of having lung cancer, your chance of dying early is dramatically increased. And so smoking is not something that will kill you instantly, but smoking is a behavior that will accumulate over time to cause you poor health and potentially kill you in the long run. And same is true for poverty or inequality, right? Being poor will not give you cancer today, will not give you diabetes today, right? But 30, 40, 50 years of living in poverty will, in the end, over the long term, give you poor health, can give you poor health, and shorten your life, right? And so the basic idea here of cumulative inequality is that economic inequality accumulates over the long term in terms of somebody's poor health. What's another way to understand this? Another way to understand this is what's called allostatic load, right? And so allostatic load is basically the measure of the wear and tear that a person experiences in their body, right? We can think of your body as like a car, right? You drive a car around, more miles you put on that car, the more wear and tear that car has, right? The more you have to take it to mechanic, the more more it wears down, and eventually, a car can only survive so many longs, and that's it, no more car. Same is true for the human body, right? The longer the human body is alive, the more wear and tear it experiences, right? One of the best measures of this is arteriosclerosis, basically a cause of high blood pressure, right? What you have is everybody has this, right? In your arteries, you have a buildup of plaque. You have your arteries get hardened. You eat cheeseburgers, you eat fatty foods. You build up this plaque in your arteries. It shrinks the blood flow in your arteries, giving you high blood pressure. And this is a cause of cardiac problems, right? Everybody has a bit of arteriosclerosis, right? Everybody has this bit of wear and tear in their arteries, right? Everybody has a degree of load, right? How much load you're carrying in your arteries. The idea here, though, is that some people have a greater load than others, right? That different people have different amounts of allostatic load. Some can have a very large load that they're carrying, and other people can have a little load, right? Load builds up over time, but what also matters is your economic position, right? People who live in poverty, people with less money, have a greater amount of allostatic load, right? Their life experiences has meant that they are experiencing more or higher degree of trouble, more health disadvantages that is increasing the wear and tear on their body. The last concept then to understand, as I said, all these things go together, is the life course perspective. So again, the idea of the life course perspective is to understand the effect of economics on a person's health. We have to see it, how it operates over the course of a person's life, right? From childhood to a teenager, to adulthood, to old age. And so again, the point here is that the effect of economic position don't happen all at once, right? But rather they accumulate. They happen over the long term. It's kind of a slow moving effect, right? And so basically the idea here is that, a person in, at the higher end of the economic ladder, they will be able to live a life, of good nutritious food, of exercise, of being able to go to the doctor, and that this will over term mean that their body is kept in good condition. right? That their allostatic load is less. Where somebody, in the reverse, somebody at the bottom of the economic ladder who doesn't have good food, eats, has to buy cheap food, has more stress in their life, has less visits to the doctor, means that they're going to, over their life course, mean they're going to be less healthy. And so the way to think about this is, well, okay, what does this mean? When will health problems really show up? When will they rear their head? Essentially, this means that it's going to rear its head in old age. Let's see if I have a picture, right? So this is really, that the outcome of economic position is really bearing fruit in old age. This is when it will show itself, right? And so we can take, we see these two older women here, and really what we're saying is, okay, the woman on the right, she's a woman who's been able to live a healthy life because of her economic position, right? She's had good food, she's been able to exercise, she's been able to go to the doctor, she's had less stress. But the person on the left, she has lived a life of poverty, had a tougher life, and that this is really showing itself in the condition of their bodies in old age. Right? And so that it's in old age that we will see the outcome of economic inequality in terms of the health of people. So, okay, here are three concepts to understand the relationship between economic position and health and life expectancy. Okay, so now we would typically, in class, we would take a musical break, but we're not doing that. You could do it on your own if you want to, but I'm going to keep on going. So now we want to talk about the causes. Right, so we've seen some of the basic facts, some of the data. We've seen some concepts to help us understand the relationship. Now we want to talk about the causes. Why is there this relationship between how much money you earn and how long you live and how healthy you will be? Okay, so let's go through them one by one. So the first one is money and access to material resources. And this is kind of what I'm going to be saying is sometimes it's self-evident, but we sometimes don't think of it. Money can buy you things, right? Money is not just good to look at. Money doesn't just allow you to, roll around in the bed with money, right? Money is useful. Money allows you to buy things, right? Money allows you to solve problems, right? So money allows you to take care of your body, right? Your body is something that needs to have money to be in good health, right? So money can buy you things like food, right? Good, nutritious food. Money allows you to buy membership to a gym to be able to exercise. Money allows you to have a good house, right? To live in an unpolluted area, right? Money solves problems, right? Money allows you to do things to keep your body in good, healthy condition, right? Again, if we compare the body to a car, what money basically does is it allows you to take your body to the mechanic. It allows you to keep your body in good condition, right? And so having money allows you to, treat your body well. The best example of this is access to medical care, right? Having more income means that you're going to have health insurance, right? And that has a dramatic effect on your ability to keep in good health, right? So, but it's not just whether or not you have health insurance, but it's the quality of that health insurance, right? So lots of people have health insurance, but it's not just whether or not you have it, but it's whether it's good health insurance. And so people with more money have better health insurance. And so better health insurance means things like the deductible, right? So, how much money do you have to pay before the health insurance will kick in, right? And so we can think about this, if the health insurance will kick in after you spend $100, right, you're much more likely to go to a doctor, right? If you have to pay $1,000 before the health insurance kicks in, then you're less likely to go see a doctor, right? You're less likely to go get pre-screened for like cancer. You're more likely to ignore something, right? There's a pain in your stomach, right? If there's a pain in your stomach and it costs you $100 to go see a doctor, you're going to go see the doctor. If there's a pain in your stomach and it costs you $1,000 to go see the doctor and you don't have much money to begin with, you're not likely to go see the doctor. What's that pain in your stomach? Maybe it's nothing. Maybe it's indigestion. Maybe you ate something bad. Maybe it's stomach cancer, right? You don't know because you're not going to go see the doctor because you can't afford to. And so what that means then is you're more likely to enter old age and have a serious health condition, something that you couldn't prevent, right? So, health, money gives you access to material resources to help you take good care of your body. And we see this from kind of everyday things like gym membership, to food, to exercise, to where you live, to most importantly, access to medical care. Stress, right? So stress is, not just a psychological experience. So often we think of stress as, something psychological, like people will say, oh, I'm feeling stressed. Like you're experiencing something in your head, you got a paper due, you're working long hours, you feel stressed. But importantly, stress is not something that just is you experience psychologically. Stress is something you experience in your body, right? Stress is a physiological experience. Stress means higher blood pressure. Stress means, a faster heart rate, right? Essentially, stress is your body's response to a threat, right? So if you experience a threat, your body will respond to kind of, defend yourself against that threat, right? What's really problematic is not just kind of temporary stress, but what's called chronic stress or toxic stress. So this is stress that is experienced day in and day out, right? That a person feels continually stressed, right? And so that continual stress, that chronic stress, means that the body is always feeling stressed out, is always on high alert, is always has high blood pressure, always is kind of being stressed out. The problem is that chronic stress produces more wear and tear on the body, produces a greater allostatic load, right? And so that, eventually that higher degree of stress on the body will wear the body out over the long term. Okay, so we can ask ourselves, well, what's stressing people out? So everybody experiences stress. Poor people experience stress, middle income people experience stress, wealthy people experience stress. Everybody experiences stress. But some people experience more stress than others. And so what we know is that people at the lower end of the economic ladder experience more stress. And you can see this here, right? So we see here that people with less money have perceived to have less stress. So we can say, oh, what are they stressed about? They're stressed about their economic position. They're stressed about losing a job. They're stressed about not paying their rent. They're stressed about getting evicted. They're stressed about not being able to take their kid to the doctors, right? And so worries over money is a major stressor in many people's lives. And the less money you have, the greater that's going to be a stress, right? So people with less money are experiencing more stress, chronic stress over their economic position. And it's not just the experience of stress, it's how people cope with that stress, right? And again, this is related to people's economic position. All right, so let's imagine you have a lot of money and you're experiencing stress. What can you do about that stress? Okay, you can get a massage. You can take days off of work and go on a holiday. You can rest. You're feeling stress. your money allows you to de-stress in a healthy way, allows you to be, have a adaptive way of responding to that stress, and that costs money. If you have less money, then you really don't have that ability to de-stress in a healthy way. And then you have to turn to unhealthy modes of responding to stress. What's an unhealthy way of responding to stress? Tobacco, right? So we see that people with less money, people with less education are more likely to smoke, more likely to use tobacco, right? What's the reason for this? This is complicated, but one of the reasons is that people with less money are using tobacco to de-stress. It's an unhealthy way to de-stress. Over the long term, it's going to cause health problems like lung cancer, but they're using it because it's a relatively cheap way to de-stress. But it's kind of a cheap fix or quick fix. It only lasts 4 or 5 minutes. Then the person's stressed again, but it's a temporary relief. Okay, so we see access to material resources, experience of stress. Then lastly, it's neighborhood effects. This is our third one. So when we're talking about neighborhood effects, is that your economic position affects not just how much money you have, but affects where you live, right? And affects the quality of the neighborhood in which you live in. That people, this is going to sound obvious, but people with more money live in better neighborhoods, right? People with less money live in worse neighborhoods. This is called the neighborhood effects, right? And so the idea here is that these neighborhood effects, living in a better or worse neighborhood, is not going to just affect the quality of the neighborhood you live in, but is going to affect your health, right? And so what we can see here is that people's life expectancy varies greatly in America based on where they live. And so here's a huge gap in the life expectancy of Americans, a gap of nearly about 20 years, right? Based on two communities where they live. So the first community is one of the poorest neighborhoods in America, the Lakota County in South Dakota, which is largely a Native American community that is very impoverished, versus Summit, Pitkin, and Eagle counties in Colorado, which is a ski community in Colorado near Aspen. It's incredibly wealthy, right? And so we see that these two communities don't have different degrees of money. They have vastly different degrees of life expectancy, right? And so the idea here is that essentially living in a poor neighborhood, not just being poor yourself, produces worse health, right? And so the idea here is you can take two people, right? Two people of the same income, right? They both earn like an average income. You put one person in a good community, a wealthy community. You put the same person in a poor community. That same person will live a shorter life and be less healthy if they live in a worse neighborhood, right? And so it's not just your own personal economic position that matters, but it's the economic position of your neighborhood that will also affect your health. But, right, then we can ask, well, who's more likely to live in a poor neighborhood? People who are poor, right? And so this is called a double jeopardy of poverty, right? The double jeopardy is, you get charged twice. And so the way you can think about it is people who are poor, they're going to have worse health because of their own personal economic position. But also on top of that, they're going to have worse health because they live in a poor neighborhood. And so they in some sense, get hit twice. Okay, why? What's happening here? Why does living in a bad neighborhood give you worse health? All right. First reason is pretty obvious or pretty basic. It's pollution. Right? People who live in worse neighborhoods live in more polluted neighborhoods, right? And if you live in a more polluted neighborhood, that's going to affect your health. Right? So for example, things like, poor neighborhoods are more likely to be built next to major highways. What's the problem with living next to a major highway? You're more likely to breathe in worse carbon dioxide, right? So it's kind of just basic pollution, right? So poorer neighborhoods are more likely to be in neighborhoods that are of more polluted and causing worse health. Okay, so that's a basic thing, pollution. Second is what we can call the built environment. So the built environment are the human physical structures that humans create. So schools, libraries, roads, sidewalks, right? And so what we see here is that people who live in poorer neighborhoods are more likely to live in a built environment that is worse for their health, right? So this is basically things like not having a sidewalk, right? So what's bad about living in a neighborhood that you don't have a sidewalk? You're less likely to walk, right? You're less likely to exercise, and so you're more likely to be obese, right? Less likely to have a playground, right? And so if you're less likely to have a playground, your children are less likely to play, like to be physically active, right? And if they're less likely to be physically active, it means like they're more likely to be obese, right? More likely to be overweight, right? And so it's really, it's about, not just pollution, but it's, what facilities, what amenities are there, right? And this is not just things that are nice to have, right? This really affects the health of a person, right? So one example, this is food deserts, right? So people who live in poorer neighborhoods are more likely to live in a neighborhood in which there is no grocery store, or the grocery store is much farther away. Right? People who live in wealthy neighborhoods are more likely to have a grocery store, more likely to have 2 or 3 grocery stores. Okay, so we can say to ourselves, okay, what's the problem with not having a grocery store? It means you don't have access to good, nutritious food, right? So again, it's not just about your own personal choices, but it's about what you are able to choose, the opportunities that are in front of you, right? If you don't have a grocery store in your neighborhood, it means that you have less of an ability to eat nutritious food, right? And so if you can't shop at a grocery store, where are you going to shop? Oh, you're going to shop at a corner store, a gas station. Now, the food choices at a gas station are not just more limited, but they're much less healthy. We're talking here about canned food, food that's higher in sodium, higher in sugars, just much worse for you. Right? So living in a food desert, this is the idea of a food desert. You're living in an area in which there's no food choices, good food choices for you. What's the opposite of a food desert? A food swamp, right? And so a food swamp is now, it's not yet there's no good food choices around you, but there's a lot of terrible food choices around you. Good example of this is fast food. And so poor neighborhoods are more likely to be neighborhoods with more fast food, right? So more likely to, poor neighborhoods are more likely to have more fast food around them, so being worse for their health. Cool. Right? What are they also more likely to have? Liquor stores. Right? So poorer neighborhoods, less likely to have grocery stores, more likely to have liquor stores. And so again, it's not just about people's choices, but it's about what are the choices in front of them, right? You're trying to de-stress, you have a stressful job, you're worried about money, and there's lots of liquor stores around you. What are you now more likely to do? More likely to drink liquor, and this is, can be bad for your health. Right? Again, tobacco, we talked about tobacco before, right? That people who with less money, less education are more likely to smoke. But it's not just about, your own personal choice, but it's, how many tobacconists are around you, right? This study from Albany, right? Poorer neighborhoods are much more likely to have more tobacco retailers in those neighborhoods, right? Making the ability to buy tobacco much more prevalent. Because again, it's not just about your choices, but it's about the options you have. Lastly, about living in a dangerous neighborhood, right? So living in a neighborhood in which there is perceived worries about crime and other forms of deviance and delinquency, right? So everything from graffiti to boarded up places, places that don't seem safe, right? What's the problem with living in an unsafe neighborhood? You're less likely to go outside. You're more likely to lock the door, be inside. You're less likely to be physically active. And we really see this in terms of children, right? Parents want to keep their children safe. And so if you live in a dangerous neighborhood, you are less likely, much less likely, to allow your children to be out on their own or be out in the streets, right? You want your children to be home safe. Unfortunately, what that means is your children are less likely to be physically active, right? So we see this in terms of obesity rates for children who live in dangerous neighborhoods, high crime neighborhoods, neighborhoods with no parks, no playgrounds, no walking paths, no rec center, right? And what we see is that there's a 20 to 60% higher rate of obesity, right? For girls, for example, it's twice as high, right? The rate of obesity of living in a bad, unsafe neighborhood compared to girls living in a good neighborhood. And then this is something that will stick with somebody for the rest of their life, right? So we often blame people for their obesity. We often criticize them and say, oh, why couldn't they just have more willpower or something like that? But it's also important to understand that, it's the conditions, right? The social, physical conditions that people grow up in that can affect, how their bodies are. It's not just about choice. It's not just about willpower, right? And so the built environment, the neighborhood in which a person lives, is having a dramatic effect on that person's body and that person's health, all the way from childhood throughout the whole course of their life. And so what we see here is that here are some of the basic causes between that relationship between economic position and a person's health, right? And so, to kind of sum this up, I think I've made this point already, but to kind of sum it up, economic inequality is not just about how much money is in your bank account. It's not just about what kind of car you drive, but it really is about how long you're going to live, right? How healthy you're going to be, whether or not you're going to be diabetic, whether or not you risk having a stroke. And so inequality is not just, something frivolous. It is something very important to people, and it's, about people's health. Okay, that's enough for today. And so I'm going to end it there.